Monday Night Live will start now. We will reconvene to public session and roll call. All board members are present, so we do have a quorum for tonight's meeting. And public comment announcement. Pursuant to board policy number 2350, public comment may be limited to 5 minutes per person or 30 minutes per topic. All speakers who would like to comment regarding a matter on the meeting agenda must submit a public comment card to the board president or recording secretary prior to the point in the meeting at which the agenda item is called. All speakers who would like to comment regarding a matter not on the meeting agenda must submit a public comment card to the board president or recording secretary prior to the point in the meeting for the open forum on non-agenda items. Public comment cards are available at the information table at the rear of the boardroom from the recording secretary or online. And Pledge of Allegiance, Mr. Buffalo, will you please lead us?
Stand, put your hand over your heart, begin with me. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much. Item 9, approval of meeting agenda. May I hear a motion to approve the agenda?
Second.
Discussion? Advice?
I approve.
All those in favor, please say aye.
Aye.
Opposed? Passes with 5 yes votes. Item 10, open forum on non-agenda items. Pamela Ford.
Good evening. Can you hear me?
Yeah.
Okay. I was unable to attend the board meeting last month, but the discussion was concerning COVID, and I just wanted to share classified employees' concerns. Part of the MOU that was agreed upon with the district was that we would be notified whenever COVID cases or exposures were brought forward. It didn't stipulate classified faculty or any students or any particular group. It just said that we would be notified. However, I'm only being notified of classified exposures. Faculty are only being notified of faculty exposures, but there's no notification as to students or administrators or anyone like that who's been exposed. And I think we're all well aware that COVID has no boundaries. It doesn't matter what classification you are. And so I would like us to relook at that and make sure that there's transparency in these exposures that are occurring on the campus. Also, I'm not being notified of all exposures that even impact my group. As an example, I was notified that there were 2 employees within my own department who had been exposed to COVID, but I did not receive any notification from the district until after I notified them that because they were the ones who had told the people they had to stay home until their incubation period, or what is it? Quarantine period. Sorry. Anyway, so I'm asking that we relook at this situation and try to be more transparent, because it's very concerning to employees that people aren't aware of what's going on. I also have had the opportunity to be in communication with other districts, and their notifications don't necessarily include the names of the individuals, but they do let the campuses as a whole know that there's been an exposure. And so I think that's important if people know that there's an exposure in their area. Also, I learned watching the board meeting last month that I had no idea that we had a faculty member on campus that had a background in infectious disease. So I think maybe we need to look at the resources that we have on campus and take advantage of that as well. Thank you.
Thank you. Ms. Despain.
Sorry, thank you. Tech. Anyway, good evening. Thank you so much for allowing me to speak. I'm here just to talk about the student side of the house in terms of I'm in student services. I'm a counselor, disability services specialist. I work with students all day, every day. And I'm a little concerned about the spring schedule. It was just released and I noticed that most of it just says flex. I believe that there was a survey, it just says flex. So it says like 40 capacity and just flex. We don't know what that means. I know that eventually they will be broken up. But for right now, the spring schedule looks a little weird. I think we're all obviously wanting students to succeed and do their best. We're all in different areas to do that. The student survey that was sent out and students responded that they preferred synchronous or face-to-face. I think there's a lot to be taken from that. I brought that up at a recent meeting and I was told, well, that wasn't a representative sample, but it is what we have. So I think it's important to listen to the students in terms of what they're asking for. When I look at the schedule, it's mostly flex. I have not heard a lot of positive feedback from students regarding the high flex model. They really do prefer to see their instructor's face either in a synchronous way or face-to-face in a classroom where they're being addressed. I think it's very difficult for them to keep focus on a screen because it's basically like this, right? And your instructor is in a little box and they can't really move too much. They're kind of talking, most of us, I think, at the computer, right? You can put the mic on, but then you have issues with whether or not you're in the camera view. So I think a lot of people are just parking it and then letting the screen be the PowerPoint or whatever it is they're presenting. This presents a unique challenge for students who have disabilities. We have roughly 700 students registered with the Office for Students with Disabilities. And students have all kinds of different issues, right? So processing disorders, hard of hearing, autism spectrum disorder, all kinds of things. And when you talk about a high flex model, you're talking about a masked instructor in a small box presenting in this kind of format, right? So imagine that you're a hard of hearing student. Hard of hearing students, they use facial gestures, lip reading. I have students that are literally just switching majors, not taking classes that they need. I have one, she has 6 classes from graduation. She needs transfer level classes. Can't do it. Her hardest classes are math. She has a higher level class as well that she has to take before she transfers to Bakersfield. She has to be able to see an instructor's face. I'm just asking that maybe we consider when we look at the schedule, even breaking it into equal thirds so that students have a real choice between synchronous, high flex, and face-to-face. I'm just very concerned for my students and I want them to succeed. I know we all do. Thank you so much.
Thank you. Moving on to item 11, presentations. Item 11.1, COVID update.
Can you hear me? Good evening. My name is Rhonda Burgess, and I'm here to talk about COVID. On the presentation here, I just kind of wanted to show, is this working here? I'm sorry? Turn it on. Okay. There we go. Thank you. Okay. These graphs are not really to show any time period in particular, but I wanted to show you these because this is the testing positivity rate, deaths and hospitalizations to show you the trend where it was really spiked and now everything is going down. It's still continuing to go down. And you guys are able to see this, right? On campus, the workload on campus has increased in the past few months, particularly in the month of August, due to several different factors. Governor Newsom lifting the mask mandate in the state of California in mid-June, increased spread of the highly contagious Delta variant hit at the same time,
and we returned to campus during the height of all of that. So all of that increased the number of cases that we were having here on campus. We continue to work closely with the County of Los Angeles Department of Public Health. I speak with them at least once every week. We talk about cases, we talk about what's going on our campus here. We've increased our tracking and tracing team. We had 2 people on our team, one on the employee side, one on the student side. We now have 2 additional people and another part-time person helping with cross-referencing, because we have areas on campus that aren't really documented like a classroom. We know when a student is in a classroom, we know how many students are in that classroom, how many faculty members are in that classroom. But if they go into counseling, there's not really a way to track that. So we've created a system where those areas are keeping track of the students that are coming into their area, and they're sending us that list, and we're cross-referencing with people who are having symptoms or have tested positive, and then notifying those people. Interpreters is another one. We have all attended the Johns Hopkins tracing training program. It is certificated. We're able to provide, with our extra help, more timely and effective contact tracing in conjunction with state and county guidelines, in working with them to create our system. We have a more thorough evaluation and improved communication with cases, exposures, and close contacts. We've also created a COVID tracing subgroup team comprised of deans, 3 deans, a faculty member, and Van, our academic senate president, has recently joined the group. And they can give us input on our weekly newsletter, assessing methodology, how we're looking at things, give us a different perspective, and dissemination of new information as it comes down from the county. On campus, we're also offering now vaccines and testing. Our vaccination clinics are every 3 weeks. And we did this so that people who get their Pfizer vaccine at one clinic can get their follow-up shot, their second shot at the second clinic. It's timed exactly for that. But if somebody would rather have Johnson & Johnson, that's available, as is Moderna. Moderna is a 4-week period of time. So if it's their second shot, they're welcome to get it. If it's their first shot, they're set up to go somewhere else to get their second shot. They're also doing boosters on Pfizer if you meet all of the requirements. And we have opened that to the public. We're also doing on-campus testing. We've been doing testing for a while, for a few months now, but we were working out with our nursing students, our nursing program, to do the testing 2 days a week. And we are expanding that now. We've hired an outside company who is going to do the testing. They started last week, unfortunately, in that sandstorm was their first day. They weren't able to actually do any testing that day, but they're here 4 days a week. So they're here from, the presentation says 11 to 2, but we've expanded that to 3 o'clock already. We've opened that up to the public. It was in the newspaper. We're advertising it now. So as that increases, as the demand increases, we'll expand the time. We're continuing our campus efforts with the self-screening for students and employees. Everybody who comes on campus every day needs to go in and fill out their self-assessment. That self-assessment is monitored on the student side and on the employee side. And if somebody answers yes to a question that they've been exposed, they're having symptoms, then we reach out to that person and find out more information. We have a weekly newsletter exclusively for COVID. It usually goes out on Mondays. And we've been doing that since April. We've only missed a couple of newsletters. Unfortunately, right before the board meeting, we were a little bit, as I said, a little bit heavier COVID flow at that time. But it's been going for 6 months now. We've also established a dedicated COVID line for improved accessibility. If somebody has questions or concerns or wants to ask about a test or a vaccine, they just have questions in general. We also have our cadets on campus assisting in areas that tend to have a little bit more exposure, like the subway area, reminding people to wear their masks in that area. So they are monitoring, and they're also helping with signs. If there's an exposure and we hang up the sign, they're helping us with that effort as well. We're also working on hiring another company to help us with COVID tracing in the future here. We have that lined up. It'll probably come to you guys next month. So we're in the process of that. And campus safety, masks, signs, hand sanitizing stations, ventilation systems are upgraded. The barriers here, I'm glad to see you all aren't stuck behind them this time. Cleaning, disinfecting, and supplies and PPE are available upon request. We keep all of that in stock. I'm sorry, I was not keeping up here. And did you have any questions?
Any questions or comments from the board?
Yes, sir. I have a couple questions. President Knudsen, is this the employee that we hired to oversee the tracers that we voted on?
She's been an employee of the district for many years, but we recently reassigned her as a project supervisor, and she's taken on the COVID responsibilities for us and working closely with HR. The other employees that you voted on, and you have two in front of you tonight, are in addition to this effort. And this is in direct relationship. I just want everybody to please understand that the conditions and protocols change rapidly and frequently, and nobody's done this before. So we're catching up and following best practices as best as we can and when we find out. But Rhonda has been a district employee for some time. We reassigned her in and she's doing a great job with getting us up to speed.
Okay, I have a couple more questions.
Yes.
How long is this going to go on, the testing and giving the shots and stuff?
The testing and vaccinations, we have them set up through the end of the fall semester, and then we'll assess it at that point.
Now, what if you get a Moderna shot, it's 4 weeks and you close down the operation? Where does the person go for the second shot?
Anywhere else where they're giving out vaccinations, there's vaccination clinics, throughout. You can go to your doctor's office, you can go to a pharmacy. There's a
You give
lot of
them
other.
cards, a little vaccination card.
And it's all put into the system. So even our vaccination clinic here, they go into the computer and everything is documented. So
Yep.
they know when you had your last shot, they know if you're in a group that is eligible to get a booster at this time. So they have everything documented.
Oh, one last question.
Yes.
Has anybody approached you about giving flu shots?
We have talked about that. And the reason we're not doing that at this time is because of the funding. Flu shots, there is a cost associated with those and they want to bill your insurance company. And what we've established is we've established free to the public for testing and for vaccinations. So they can just come in, they can get it done. But if we did the flu shots as well, they would have to go through filling out all of the paperwork, insurance forms, that type of thing. So we're trying to keep it just exclusive to COVID, but we are putting that in our newsletter. If you read our newsletter today, it is in there, recommending that people get their flu vaccines as well.
Okay, thank you very much.
You're very welcome. Yes,
Barbara?
Sorry about that.
that's okay.
When you talk about the daily self-screening for students and employees, can you just give me a little bit of an idea? How long does it take the students to fill this out and where do they fill it out? The students who are attending on campus.
Where would they go to fill it out?
Uh-huh.
It's on the public webpage. So they can just go on their phone, on an electronic device, they can go on a computer, and it takes maybe 20, 30 seconds. It's very short. It's just a short series of questions.
And so is the students who are attending in person? So obviously their instructors are aware that they have to do this before they enter the class. Is that how that works?
Yes, everybody should be aware of that at this point. We make it a point that every person who comes to campus, whether it be students or whether it be staff, whether it be faculty, everybody who comes on campus has to fill out that assessment.
Okay.
Each day they're on campus.
Okay, and just one other question. On your last page, campus safety, the last bullet, supplies and PPE available upon request.
Mhm.
Like who would a faculty member have to go to request? Are we not supplying them, or are we making them have to request certain items?
I believe it's both. So it's facilities that has all of the PPE in stock. And Aaron Tague is the person who handles that specifically. If it's not stocked, if they run out, they need extra stock, they would like something different, whatever it meets their comfort. They can just ask and it will be delivered to them.
Thank you.
You're welcome.
Ms. Arden?
Yes, Rhonda, I
Yes.
just wanted to say thank you. I was concerned about contacting and tracing people who had been exposed to the virus. But what I'm hearing, and I was hoping for improvement by this board meeting, and I do see that, so I want to acknowledge that.
Good, thank you.
From 2 to 4 people, you're now cross-referencing students. You have interpreters for families. Your staff has gone through the Johns Hopkins tracing program. You have a COVID subgroup that looks over the work you're doing to make sure you're touching every point that needs to be. Testing is available 4 times a week. You have a weekly newsletter and a dedicated COVID line.
Yes,
So
you paid very good attention. Thank you for that.
You're welcome. So I just want to say thank you. The improvements are noted and I appreciate the report.
Thank you very much.
Any other questions, or comments from the board? Thank you very much.
Thank you.
Item 11.2, technology update. Good.
Just so that I can see that in front of me. Thank you for your time. And I want to clarify just briefly, the daily survey is actually a web-based survey that is authenticated. You go in through the portal. And the first step in that is either student or employee. You click a button and it redirects to one or the other. And then it's done completely online. I've been asked to come up and address what Tech and IMC has done with relationships to COVID and specifically some of the concerns raised by faculty at the last meeting. To do that, I think it's kind of important to do a little bit of history, so forgive me. I've got a quick bullet list here of things that we'll cover. I'm going to talk about our initial pivot to moving remote. I'm going to talk about the computer loan program and where it is now. I'm going to talk about faculty training. I'm going to talk about the specifics raised at the meeting last month, and then other activities. Back in mid-March of last year, whoops, thank you. Push the button there. Nope, you turned it off. There it goes. Even the tech guy has tech issues from time to time. In mid-March, when we made this pivot and everybody went remote, IT was tasked with a tremendous lift. In addition to assisting all of the faculty and staff and getting them remotely, trying to facilitate rapidly training and access to equipment for employees to work remotely, and providing those facilities through our mechanisms so they can work effectively remotely. Amongst those services, we had to re-engineer our phone system so that it would allow access from off campus. Previously, it was structured only on campus. We restructured our licensing for it so folks could install that client on any device. Their home computer then could become what amounts to a soft phone. We re-engineered remote access to desktops and established a terminal server. We named that AVC remote. So rather than exposing the campus network to multiple personal devices by VPN, because what happens when you do a VPN is the computer becomes part of the network. And since we didn't know what was on those personal devices, we wanted to minimize that exposure. So we stood up a series of servers to establish a web-based desktop. That was our standard Windows desktop. We dubbed that AVC remote. folks had access to their mounted file shares, their personal file shares, and the ability to produce PDFs to share by email or other things. In addition to that, folks who had very specialized duties and needed very specialized equipment from their desk, we literally picked up, took to their cars, helped them do that, and then in the inverse when we came back. And then we had the task of pivoting, if you will, all of our instructional labs, all of our computer-based instruction labs. The easiest way to do that was to allow them to function as a remote terminal individually. So we established a broker and then architected that interface for the students as if they were logging into that lab. If I had a computer science class in MH 324, that was the lab that I logged into, and that was the desktop that was available to them. Imagine the lift that was necessary for a staff of 3 sysadmins and some support folks. And they did this in a matter of a couple of weeks. In addition to that, shortly after we started propagating the use of Adobe Sign to digitize and route digital signatures. The business of the college has to happen. Folks have to be autographed and passed along. And then there was a tremendous amount of training and support that went on. And I'll talk a little bit about what Dr. Purisky and his team in IMC did in a second. But before that, I want to talk about computer loan program. And again, in mid-March, we didn't know how long this was going to last, and we didn't know what the demand was going to be. So the first step was to determine what the demand was. And we did a very quick survey of faculty. Faculty know their students, they know what their students' needs are. Many of the faculty simply went to their students and said, do you have need? Information was communicated back to us. We literally stripped laptops out of carts and desktops with cameras built in out of labs and bought a boatload of Chromebooks. We also acquired 400 hotspots in various batches. In that first week of distribution, that first week of April, we took, let me back one step, just a second. I'm gonna do that. There we go. We determined the need, we identified an inventory, and then we set up an appointment structure. In that first week, from April 2nd to April 8th, I believe it was, thereabouts, we distributed 360 devices. Those devices had to come out of the instructional space, be completely reset for access for remote so the students could function remotely. These things were locked down specific to their task and their space on the network. So my techs had to completely wipe, reset the permissions on these things, and then put them out for students to borrow. We set up an appointment structure. Students pulled through the driveway at the warehouse. Dawn was nice enough to let us use the warehouse driveway. And my folks volunteered to stand out there, work through the forms, deliver the Chromebook, deliver the laptop to the car, completely hands off to the students. So nobody, other than signing a form saying I'm accepting this, there was no interaction physically. I can't tell you how proud I am of this group. Since we did this, this interacting with these students and the gratitude that they express is just moving. So forgive me. But to a person, when they thank you, because you don't realize the dependency on on-campus resources until they're not there. And for the better part of a year, those open labs weren't there. So the students couldn't keep up. Sorry. Since its inception, we've done 1,135 loan transactions. Equipment loaned out, equipment returned. We've also done 498 hotspot transactions. We're also working through a recall with some of Verizon's hotspots because they had a fire danger. Now, they sent out a software patch to eliminate that potential, but we'd really rather have them back and have them have something else. Distance ed and high flex training. The vast majority of the success on this lies at the hands of Alex Purisky and his staff. They've run 6 training, no, they've run, I'm sorry, training cycles in March, in summer and fall of 20, and spring and summer of 21. The training cycles consist of 6 modules. Literally, how do I teach online? How do I build my course in Canvas? How do I build a quiz in Canvas? How do I manage my documents? Some of the faculty techno-challenged. In some cases, when we've been remote, some of us have made house calls. We don't touch personal devices, but faculty are desperate. We want to make sure they're successful. We had one who could not work it out at home. We let him use his lab, his office here on campus. He comes in, he closes his office door. He's only in his office when he was doing it. And then he went home just so that he had the technology he needed to work with his faculty, his students. In addition to those 4 training cycles, they've just kicked off another one this week, right? This week, last week. Thank you, 25th. And that's got 40 additional faculty in it as well. In addition, we had 130 complete those previous 4 cycles. We've got another 40 involved now. So that's 170 plus faculty who will have gone through this by the time this past cycle completes. In addition to this, with the high flex structure in the classrooms and the equipment in the classrooms, Alex and Greg did 1-hour sessions, 1-on-1, 1-on-2, 1-on-3 in the classroom. This is what the panel looks like. This is what this panel does. This is what this goes where. I'm sorry for folks online. So that they understood the camera controls and the statics, also understood how to change the camera settings if they needed, understood where the controls were to things. The base design in these workstations is this base design that was deployed in Uhazy Hall in 2012. The added complexity of the camera and then some of the sound issues have been the biggest challenge. And I'll touch on those a little bit in a second. But I cannot compliment and praise Alex and Greg and their dedication to ensuring faculty can do what they need to do. A couple of comments specific to the 13th meeting last week. And they focused largely around in-classroom technology. And I acknowledge that mistakes have been made. We did not anticipate the burn rate for batteries in the lavalier mics. The little lapel mic, the ones that are in Uhazy Hall have 9-volt batteries. They've got a much longer burn rate. The ones that are in every place else use 2 AA's. And it seems if you use it for 2 hours, you forget to turn it off, we burn through them. I went out and literally, I went to Costco, bought a case of batteries. We have distributed 2 or 3 blister packs of 100 each to the division offices. They're now available as supplies, just like if they were going to pick up a marker for their whiteboard. I have told all of the deans, you run out of batteries, call me. We have more in my office. I will go buy more to make sure the faculty have these available to them. Zoom. In the early days of the pivot online, Zoom could not scale up rapidly enough and had performance issues. They then spun up rapidly to tweak and add enhanced features, and their patch cycle is something that we've had to accommodate to the point that we simply don't manage it. We leave their automatic patching on. Unfortunately, that occasionally creates issues because if we don't patch a box and then it breaks functionality with everything else. We do patch a box, it breaks functionality with something else. It's simply something we don't have control over. The client software seems to work better than the web interface, but it's something that we're working with and doing the best we can with, but there's not much I can do beyond, it's broke, go fix. I did a quick search, and this is on this slide here, of our ticketing system since the start of fall 21. So 2nd week of August. Since the 2nd week of August, Help Desk has handled 1,915 tickets. Now that number comes from 2+ weeks ago when I did this slide. That number's gone up since then. It's as of October 1st. I did a keyword search based upon Zoom, patching, audio, and batteries. And then there's the breakdown below on what those are. We've only had 173 tickets opened about Zoom. This is mid-October. Semester started in August. Add that sound and mic and others, 103 tickets. Here's what it comes down to. I've had anecdotal conversations with half a dozen faculty who go, Rick, I didn't want to bother you with this. You guys at the help desk are busy dealing with other stuff. We don't want to bother with you this. Bother me with it. It's what we do. It is our job. Don't assume that we're too busy for this. And that's what I have said to everybody that I have talked to. Dial 6535, tell me it's broke. I can't fix it if I don't know it's broke. To the next one. Here's the one that drives me the nuttiest, if you will. Is that the right adjective for this? It's close. We made the decision, we recognized that coming back, the world was not going to be the same. Instruction could not be the same. So we needed to complete our AV update of the classrooms, and we needed to enhance that to allow for video remote instruction. We had a conversation at exec. I went to the president. We got that first round of HERF money. He said, how much? I said, roughly 1.8. He went, here you go. I turned around and went to my director of tech ops, my Dean Lunegro, and I said, we have a spec for the rooms. We need to add this additional technology. Go do. Somewhere between the base design that is in New Hazy Hall, the conversations around adding microphones and cameras to the classroom, and the lapel mics and the other configurations that we needed to do, the ceiling mics got dropped out of one of those configurations. I don't know how, but you can imagine with everything that we had going on and all the moving parts that we had going on between May and June and July, it happened. And it was wrong, and it is what it is. We did a spec, we sent it out to vendors, we got a quote back. The quote, the low bid is the better way of describing it. What turned out was not complete with all of the equipment. And we had to go back to that vendor, and you omitted these things, and that started around a negotiation, which then started around a schedule fund. And the reality is that we really didn't get busy on the implementation of this AV until late October, early November, to have it ready for spring. And we worked in through spring to do that. Summer turned out to be our first live exercise with this new config. And we very quickly tripped across two huge issues. One was the ceiling lights, and the fact that the students participating in the classroom could not be heard by the students online. The other was faculty frequently set up their instructional station with the one display, and they have their Zoom session there and their slides there, and they flip between them. Well, if you've got your Zoom session there and you've got a live chat session going, there is the potential for something confidential from a student to the instructor to end up on the big screen in the classroom, or potentially something big problem. We've worked through the config issues with the sound. We have all of the equipment in the warehouse. Now it's an issue of sequencing with our vendor the installation of that additional equipment. We're also working with supply chain issues for what will be dual displays at every instructional station. So the instructor will have the main display, which will be what's on the screen in the classroom and what's being broadcast, and then a secondary display that is private to them. It can have their lecture notes, it can have their chat windows, whatever, but it is separate and private to them. That'll assist the faculty in managing that issue. I wish I could tell you that I will have all of this ready for spring. I really wish I could, but the supply chain issues have been all over the news, and I know you have heard of all those. We will get the sound stuff that we have installed and ready to go. We're trying to find suppliers for the updated instructional station workstations, the computers, and we're hoping to have those as well. And I kind of bleeded into the lessons learned, and I apologize. But I think I hit all of them: the sound, the delays in getting equipment, the instructional station displays. Yes, I hit on all of those. Before I dive into other activities, I did neglect to mention one thing, and I want also to call out the support of Dean Dyer. When we pivoted to the computer loan program, she said, take out of all of the carts and everything that's in the Learning Center, because we're not going to use it, take those and make those useful. In addition to that, she made basic skills money available to buy Chromebooks for students. A good portion of that was funded through there. Her support was instrumental in getting those things going. I'm gonna flip to what's next, because as you imagine, we're still busy. Actually, let me take that back. I have other activities. In addition to all of that, everything else that we were doing, we did a complete refresh of the Wi-Fi system on campus while the campus was empty. We refreshed the student print system, WIPA. WIPA now provides cost per page printing. It's a cloud-based service. The student can print from their PDA, their tablet, their laptop from home to any print station in the WIPA network, which means any print station on campus. And we have 10 of them. EduNav, it went through its pilot phase with this most recent reg cycle. 343 students went through successfully, did an ed plan, and worked through their registration, one-click registration and into the system, did add drops through it as well. The next cycle for spring 20, with the reg cycle that starts in November, will be for all newly enrolled students. We're trying to phase this approach in to reduce the load on faculty and make sure that we're getting everything right as it goes out. The new portal launched, my.avc.edu. Please take a look. We're actually very pleased with the outcome. It's a much more responsive, much lighter page, much more stable than our old Luminous platform, which was run on premise. And the vendor has been incredibly responsive in assisting us in working through issues as we've done the implementation. Actually, oh, there we go. And then the first couple of weeks before the start of the semester and into the first couple of weeks of the semester, we were heavily involved in the investigations in enrollment for fraud, in trying to figure out how they were doing it, how to identify them, and then how to exclude them from future cycles. And on this front, I will lend props to my Director of Enterprise Apps, Daniel Connor. Daniel and his team did a tremendous job in reaching out to peer institutions. How are you doing this? And then building a very robust dashboard with our reporting platform so that we can run current and past enrollment cycles through it, and even down to an individual class if we need to make sure that we're addressing those things. They did a phenomenal job in identifying that. What's next? We look at what we've dealt with and how to best address the needs of the college moving forward. And some of those things will involve moving to the cloud. And moving to the cloud does a number of things for us. It gives us greater flexibility with hardware based on load, greater physical security because it's off-prem, and that goes to DR and VR. disaster recovery and business resumption, which we've had conversations about in the past. When the earth moves 7-8 miles from here or somewhere nearby, having all of the enterprise services outside of the quake zone will enhance our capacity to rapidly resume business. The first steps in that will be moving Banner and all of its support systems, databases, and other things. We're using HERF money to do this as a security function and an access function. We hope to have that completed by March. Two-factor authentication. This goes to managing fraud and what's the word I want? Misappropriation, hacking of accounts. Our current single sign-on platform, PortalGuard, allows for two-factor authentication. Anybody can go into it now and configure it. And when you go to log in, it will send you a 6-digit code to your phone or a 6-digit code to your email. Or if you choose to use one of the free authenticator apps by Microsoft or Google or PortalGuard, who does our single sign-on, it will go to there as well. So it's completely at no cost to the student other than using their device. Some students don't have a device. So we've purchased a large quantity of what are called, thank you. I don't know why I can't keep that in my head, UV keys that are a USB. You plug it into the computer, you go to log in, you tap it, and it populates with that 6-digit code. So if for whatever reason, students, faculty, staff don't want to use their personal device, don't want to use another email address or something, we'll have these available to them as well. Enhancements to storage and computing capacity to support things like virtualization of our labs to make them more flexible and to better deliver those things remotely to students if we have to pivot to an online. We're beefing up our internal hardware infrastructure as well. We're also beefing up our network hardware as well and increasing the battery life in our network closets as a safety move. That's right. We're also doing the refresh in the theater. The AV equipment that is in the theater is what went in there in 2012 when it opened, I believe. We're doing a full refresh of all of the equipment up in that lighting booth and the sound. We're plotting the next major upgrade to Banner 9. That was put on hold due to combination of COVID and not having a DBA for over a year. Having a database administrator is integral to completing a project of that magnitude. She started last week. We could not be happier to have a DBA back on staff. And then several safety projects that we're working on addressing, continuing to expand our security camera footprint for the physical security plant of the campus, and then a full refresh and replacement of the emergency blue phone system. I think that's everything on that list. It is. And I've talked a lot. Questions?
Questions or comments from the board?
Trustee
Yes,
Gaines?
I have a couple quick
Please.
questions, Rick, please. I believe I understand what high flex is.
Yes.
And please correct me if I'm wrong, because I'm not used to that term. I think it is in person with a combination of synchronous instruction. Am I correct?
That is correct. What happens is the camera is activated in the classroom, the microphones are activated, and what happens in the classroom is broadcast through Zoom.
Okay, so, and I don't know that you can answer this question only because it might be a question that President Knudsen has to answer. But currently for fall semester, how many of our classes are using a high flex model versus an in-person only instruction?
As opposed to in-person only, I want to say it's close to 80%. Yeah, I'm getting a nod. That's close. But we've got several CTE courses and essential courses that have been face-to-face, in-person, fully populated through this entire process. Nursing, the airframe program, fire tech, and some others. But other than that, I think most all of them have gone to the high flex model.
Okay, yeah, I'll hold that thought for a minute. Okay, and then you mentioned at one time that you had about 1,135 loans.
Yes.
For either, I don't know if that's.
That's either loaning it out or getting it returned, resetting it and loaning it again.
Okay, but my question is, I know because we also lend out computers. Out of that, how many are we not recovering?
I'm doing a reconciliation on that right now. I've delayed doing that until the late start classes had their start so that we could address it and then have a full number. And I'll send that note back for the next meeting.
Pretty much it. Thank
Ms.
you.
Ivey?
Yes, just a quick question.
Yes.
Are we going 100% cloud-based or are we going to do server backups physically?
Yes and yes.
Okay, so it's a hybrid.
Our current disaster recovery or backup model does a snapshot of our data on a 1 hour, 2 hour, 4 hour, 1 day or 1 week model, depending upon the system.
Mhm.
That is all currently being snapshotted to a data center in Stockton, out of the quake zone, in a data center that's run by San Joaquin Delta. And candidly, it's being done at a pittance. It's not costing us much. It's our hardware in their data center. Our major enterprise applications will transition away from that into an AWS, Amazon's software platform in the cloud. It will remain stateside by regulation. And they do backups and they have a backup mechanism for us as well. So it's all within that and going to multiple data centers.
And just the last thing, a comment, Rick, is that the students that we serve, education, as with most students, is extremely important.
Yes.
And I think that community college is a stepping stone to a 4-year degree and other avenues of work and employment. So the emotion that you displayed, to me, is a sign of caring for students. And I don't think you should ever apologize about caring about the life outcomes of the young people and adults that we serve, because it's important.
It is.
And so I want you to know, thank you for that. And I really appreciate your report. And
Thank you. Thank you.
You're welcome.
Ms. Rivera?
Yes, I'd also like to thank you and your team for all the work you've been doing for all the students at AVC. I know it's been much appreciated and it's really helped all students be able to take classes. And as Ms. Harvey said, has allowed them to continue their education. We really appreciate it.
Thank you very much.
Any other questions or comments from the board? Thank you very much.
Thank you all for your time.
Item 12, report of closed session action. There were no reportable actions taken in closed session. Item 13, consent agenda. May I hear a motion to approve the consent agenda items by unanimous consent.
So moved.
Second.
Discussion?
Mr. President,
Yes?
I'd like to call 13.9, please.
13.9. Then may I hear a motion to approve consent agenda items 13.1 through 13.8 and 13.10 through 13.13. So moved.
Second.
Discussion? Advice?
I approve.
All those in favor, please say aye.
Aye.
Opposed? Passes with 5 yes votes. Item 13.9, bookstore balance sheet and income statement for July 2021 revised. Mr. Reeves?
Yes, I wonder if anybody representing the bookstore here knows about the operation of the bookstore.
I can help answer this question.
Oh, okay. I understand that we went with Barnes and Noble because we were losing money over there. And am I correct, in July and August, we lost money?
In July and August, we had outsourced the operations there. So July and August are closing out the prior year's transactions. So in July, at the end of last year was June 30th was our final day of operation. And July 1st, our new year begins. We'll then have some residual transactions from the prior year, and that's what we should be seeing in July, August, even in September. So those transactions will continue to occur for a number of months until all business is finalized.
Thank you very much.
Thank you.
There are no other questions. I hear a motion to approve consent agenda item 13.9.
So moved. Second?
Discussion? Advice?
I approve.
All those in favor, please say aye.
Aye.
Opposed? Passes with 5 yes votes. Item 14, action item. 14.1, approval of resolution number 21-22/4 honoring Diane Knipple. May I hear a motion?
So moved. Second?
Discussion?
Yes, Mr. President. I'd like to make a comment.
Go ahead.
I'm honored that we're honoring Diane tonight. I attended board meeting here at AV College, and I attended board meetings at ABTA, the bus company. And Diane is on the board at ABTA. She's always been exceptionally polite every time I've spoken, even though there were some members of the board that get a little upset. But she's always polite, and Diane's always the one, when they honor an employee, she goes down and puts her arm around them to just a picture. So I'm really honored to honor you tonight. Well,
Any further discussion? Advice?
I approve.
All those in favor, please say aye.
Aye.
Opposed? Passes with 5 yes votes. Item 14.2, approval of memorandum of understanding between Antelope Valley College Federation of Teachers and Antelope Valley College Community District regarding class climate. Is there a motion?
So moved. Second?
Discussion? Advice?
I approve.
All those in favor, please say aye.
Aye.
Opposed? Passes with 5 yes votes. Item 14.3, approval of amendment number 2 to the consultant services agreement with Atkinson, Adelson, Loya, Rudd, and Romo for services working with human resources. May I hear a motion?
So moved. Second?
Discussion? Advice?
I approve.
All those in favor, please say aye.
Aye.
Opposed? Passes with 5 yes votes. Item 14.4, approval of professional services agreement with consultant for COVID tracking and tracing for state guidelines with CARES funds. May I hear a motion?
So moved.
Second. And I have a card for that one, Dr. Bird.
Thank you. Can you hear me?
Yes.
Okay. So first of all, I do want to say that I really, really appreciate all of Rhonda's work and that of the other contact tracers. I've had numerous communications with Rhonda, and they're always professional and polite. And I know she's under a lot of stress because I know she's dealing with a lot of unhappy people right now. And so I don't want to denigrate their work. And I know they're working really hard under difficult circumstances. My comments here are more for the overall situation and not directed at the specific tracers. I want to be very clear on that. The thing is, though, I was looking at the items listed in board docs, and it looks like the contract is for September 10th onward, but we're still seeing some issues. And I wanted to inquire as to the exact start date of the new tracers, because hopefully that will let us see when the problems, when they stop being so overwhelmed. We're still getting a lot of quarantine notices that seem to be too late to be really helpful, although it does seem like maybe it has improved a little bit. We're still a big problem for faculty is that the students are having to notify other instructors in kind of a piecemeal manner if their whole class gets quarantined. And even as late as September 29th, I was still seeing emails between contact tracing and faculty saying things like, I'm not able to notify literally hundreds of individual instructors for each of those students in cases where the whole class got quarantined. And so that's very difficult for faculty still. In a personal sense, I've had at least 20 students be placed on quarantine by AVC in the first 9 weeks of the semester. And since I only have about 65 unduplicated students in my face-to-face sections, we are tracking towards somewhere between half and 2/3 of my students are going to be quarantined by the end of the term. And yeah, it's probably only a matter of time before that's me as well. During the month of September, there appear to have been at least 30 instances where instructors were exposed to COVID through, the on-campus workplace, based on the AB 685 notices, which I'm receiving and which Pam Ford mentioned earlier. And the official AVC case count seems to show an increase of about 30 cases in the last month. There's something about these numbers that's very concerning. I'll speak to that later in my constituent report because it doesn't really relate to the contact tracers. But after 8 weeks of class, there are instructors who've already been exposed 4 times on campus. That's after 8 weeks. One of these instructors had 2 exposures within 2 days. There is something still not right here. Does LA County Public Health know about these repeated exposures? I hope you are reporting. But really, what kind of quality of instruction is provided when somebody has 4 exposures and each time they basically get taken out for, a couple of days because even under best case circumstances, they probably have to go get tested, et cetera, et cetera. What happens when that happens to somebody 4 times in 8 weeks? I've got students that are on their 2nd quarantine out of my class. So getting more COVID tracers on staff is an improvement, but there's still something more that I would hope can be done to improve this picture. That's all. Thank you.
Thank you. Discussion?
Yes, sir. Mr. President, I have a question for President. Funds to hire employee to help consultant. Where are those funds coming from?
Federal government. Thank President Biden.
Okay. They were only like $13,000 per employee. That's not a lot of money.
It's only for 6 weeks till the end of the semester when we reassess.
Okay. Thank you very much.
Further discussion? Advice?
I approve.
All those in favor, please say aye.
Aye.
Opposed? Passes with 5 yes votes. Item 14.5, approval of professional services agreement with consultant for COVID tracking and tracing for state guidelines with CARES funds. May I hear a motion?
So move.
Second. May I have a card for that one, Dr. Bird? Did you want to speak on this one as well?
Yeah. For 14.5, no, I just wanted to speak once for the two of them. Thanks.
Thank you. Discussion? Advice?
I approve.
All those in favor, please say aye.
Aye.
Opposed? Passes with 5 yes votes. Item 14.6, approval of consultant service agreement with Total Computation Services Systems, TCS, for other post-employment benefits, OPEB, actuarial study. May I hear a motion?
So move. Second.
Discussion? Advice?
I approve.
All those in favor, please say aye.
Aye.
Opposed? Passes with 5 yes votes. Item 14.7, approval of memorandum of understanding with the people concerned for housing navigation and location program for students experiencing homelessness. May I hear a motion?
Second.
Discussion?
Mr. President,
Yes?
I have some comments and also have a prepared remark that the board has a copy of, but I was doing some little research on the internet about the people concerned. And just for the record, they are the ones that run Kensington campus. Is that correct? They're in charge of Kensington campus, the facility in Lancaster. So I'm going to read a statement. Today in the Antelope Valley, we have many organizations that are helping the homeless and those less fortunate. Fortunately, some of the things that they do may be duplicated by other organizations. And also, since there are many resources and they're scattered throughout the valley, homeless people may not know how to navigate the system to get help. We need to be on the same page. Antelope Valley College is a leader in training students for the future. We're also a leader in providing for our students by having a food giveaway once a month, student loans, and by contracting out to a hotel chain to provide housing for students as needed. And we provide medical resources for our students. The faculty and staff at AV College are also aware and take the initiative when it is apparent that a student is in need. I believe it's time we put the resources of nonprofit, local governments, and major employers under one umbrella. I'm making a motion for AV College to host a series of morning meetings with all the parties involved, including our students, if they wish to participate and increase their knowledge of the homeless problem, and narrow down who is doing what for whom and how can we make things better. Our whole industry like people's concern, by the way, that sprung up to help the homeless. I feel that some of them are taking advantage of the situation and not adequately addressing the homeless problem. All you have to do is look around you when you travel across the valley. You see the problem and know that despite well intentions by all concerned, we need to unite and do better. Again, I make a motion to have a series of meetings of the homeless providers on our campus.
It's inappropriate to make a motion that's not on the agenda. However, you can ask the president to put that item on the agenda for a future meeting. Any further discussion? Advice?
I approve.
All those in favor, please say aye.
Aye.
Opposed? Passes with 5 yes votes. Item 14.8, approval of banquet and meeting facility contract with John P. Deopolis Hellenic Center. May I hear a motion?
So move.
Second.
Discussion? Advice?
I approve.
All those in favor, please say aye.
Aye.
Opposed? Passes with 5 yes votes. Item 14.9, approval to dispose of surplus obsolete supplies and equipment. May I hear a motion? So moved.
Second.
Discussion? Advice?
I approve.
All those in favor, please say aye.
Aye.
Opposed? Passes with 5 yes votes. Item 14.10, approval of professional service agreement with High Desert Auction for the annual Antelope Valley College auction. In your motion.
So second.
Discussion? Advice?
I approve.
All those in favor, please say aye.
Aye.
Opposed? Passes with 5 yes votes. Item 14.11, approval of master services agreement with National Student Clearinghouse for enrollment reporting purposes. May I hear a motion?
So move.
Second.
Discussion? Advice?
I approve.
All those in favor, please say aye.
Aye.
Opposed? Passes with 5 yes votes. Item 14.12, approval to purchase security camera equipment and software from Black Box Corporation. May I hear a motion?
So move.
Second.
Discussion? Advice?
I approve.
All those in favor, please say aye.
Aye.
Opposed? Passes with 5 yes votes. Item 14.13, approval of addendum to master services agreement with Strata Information Group. May I hear a motion?
So move. Second.
Discussion? Advice?
I approve.
All those in favor, please say aye.
Aye.
Opposed? Passes with 5 yes votes. Item 14.14, approval of master agreement for ongoing laboratory of record services with American Engineering Laboratories Incorporated, Atlas Technical Consultants LLC, and MTGL Incorporated. May I hear a motion?
So
moved.
second.
Discussion? Advice?
I approve.
All those in favor, please say aye.
Aye.
Opposed? Passes with 5 yes votes. Item 14.15, approval of consultant services with Lazaro Arvizu to provide Aztec indigenous dancers, workshops, and performances as scheduled by the district. May I hear a motion? So moved.
Second.
Discussion? Advice?
I approve.
All those in favor, please say aye.
Aye.
Opposed? Passes with 5 yes votes. Item 14.16, approval of consultant service agreement with Brandon Alexander Williams, EBA Modern Day Griot, to provide workshops, performances, and presentations to Umoja and A2 men with district staff and faculty. May I hear a motion? So moved.
Second.
Discussion?
Mr. President,
Yes?
so anybody here present can give us a discussion of what this is all about?
So what the agreement will be is basically engagement activities that are culturally relative to student populations on campus, specifically the Men as African American Male Club and the Umoja program, which is, of course, everyone's invited, but it focuses on African American culture. So it's their engagement activities that take place for the program.
So what's the cost of this program?
I don't have that in front of me, but it's, if I remember correctly, I think off the top of my head, there was a amount set aside, but only a certain amount will be used. And so each activity, there's an hourly rate, I believe, and then there's a performance rate. So it's in line with the rest of our contracts for student engagement. But I just don't remember the exact number off the top of my head.
Thank you very much.
Further discussion? Advice?
I approve.
All those in favor, please say aye.
Aye.
Opposed? Passes with 5 yes votes. Item 14.17, Approval of consultant service agreement with African Soul International to assist with the facilitation and implementation of the Umoja programming. May I hear a motion?
So moved.
Second. Discussion? Advice?
I approve.
All those in favor, please say aye.
Aye.
Opposed? Passes with 5 yes votes. Item 14.18, approval of cleaning services with Darrow's Cleaning for the Sage Hall Project 17-031 with major AV funds. May I hear a motion?
So moved.
Second.
Discussion? Advice?
I approve.
All those in favor, please say aye.
Aye.
Opposed? Passes with 5 yes votes. Item 14.19, approval of change orders for Sage Hall 17-031 with major AV funds. May I hear a motion?
So moved.
Second.
Discussion? Advice?
I approve.
All those in favor, please say aye.
Aye.
Opposed? Passes with 5 yes votes. Item 14.20, approval of change orders for student services 17.17-037 with major AV funds. May I hear a motion?
So moved.
Second.
Discussion? Advice?
I approve.
All those in favor, please say aye.
Aye.
Opposed? Passes with 5 yes votes. Item 14.21, approval of change orders for Discovery Lab Project 17-039 with major AV funds. May I hear a motion?
So moved.
Second. Discussion? Advice?
I approve.
All those in favor, please say aye.
Aye.
Opposed? Passes with 5 yes votes. Item 15, information item. 15.1, Antelope Valley College Facility Services Quarterly Report is in the packet. 15.2, first reading of board policy 2345, public participation in board meetings is in the packet. And item 15.3, first reading of board policy 2350, speakers. I have 2 cards for that one. Dr. Bird.
Hi again, can you hear me?
Yep.
All right. So I am worried about how this is being advanced to the board because it seems to me that there may be a violation of AP 2510, Administrative Procedure 2510. I was curious as to when the agenda was finalized for this board meeting, because I know it was postponed a week, because as best I can tell, it was not recommended to the board from CCC in time for the 11th. So maybe it came to this agenda later. I'm a little bit confused about that, but also at the October 13th CCC meeting, it did come up for a vote, but after the official end time of the meeting, when I had to leave to attend another meeting, and I've been informed that at least one of the 7 voting members voted against it, in which case, based on AP 2510, my understanding is that this should not have advanced to the board, because to advance to the board requires consensus of 6 of 7 CCC members. I did contact the chair of the CCC after the meeting to register my objection to sending it forward. And I am on the record, or should be at previous meetings, as objecting to what's in this policy. My concern here in part is that choosing to advance an item to the board by voting on it after the end time of the meeting is inappropriate. Beyond my concern over AVC's apparent inability to follow its own procedures, quite frankly, reducing the speaking time is just a bad idea. At last month's meeting, AVCFT's then Vice President David Adams spoke passionately against approving a reduction in speaking time. Sometimes speakers would like to convey more complicated thoughts or issues to the board, and sometimes 3 minutes is just not enough. This is the only opportunity most members of the campus community have to address the board as a whole. In addition, I've been told that this would also affect the length of constituent reports unless we specifically request additional time. I ask on the record, did the speakers for items 11.1 and 11.2 tonight request additional time beyond the current 5-minute limit? Were they restricted in their time? My constituent report is no less valuable than any other item on this agenda. And frankly, it's pretty much my only opportunity to communicate with the board. If I recall correctly, the stated goal of this revision is to increase the number of speakers. But with all due respect, when is the last time the number of speakers on any topic was greater than 6? I'd also like to point out that a decision to limit the speakers on a topic to 30 minutes total is arbitrary and stifles discourse. Most of the time, we all know that there are few or no speakers. So if the community actually gets excited about something, in my opinion, we should all sit down and listen and not look for ways to stifle the discourse or get the meeting to finish sooner. As most of you know, I'm going to be nursing a baby when I get home. I don't want to be here all night either, but listening to the meeting and listening to the speakers is really, really, really important. I understand this is only an informational item, but I want to be on the record as clearly as possible that I don't believe AVC is following its own procedures in placing this item on the agenda. It's a bit premature still, and that this reduction in speaking time is a mistake. Thanks.
Thank you. Pamela Ford.
Good evening again. You are receiving the first reading of BP 2350, and the Federation would ask that the board give consideration to not limiting speaking time to 3 minutes. I currently have been appointed by CFT to the Chancellor's Consultation Council panel, and we review and address policies, procedures, and so forth. One statement they constantly sound down to us is that as a panel, we need to not look at, but interrogate our processes and review their application and processes, and look at how are we following those. I think one of the most heartening actions I've seen with the board is when board president Laura Herman, when there was discord from the community as well as the campus concerning how a student was treated, that people were allowed to come forward and fully speak their 5 minutes regarding their concerns. Now, some of you on the board, I realize, didn't appreciate that, but that is the role of the board, of you as elected officials. Also, to minimize the amount of time for speaking seems to infringe on people's First Amendment rights. So I think another thing that the Chancellor's office really stressed, and that I noticed, is when we have our meetings and then we come forward with the Board of Governors, there are a lot of discussions that involve dissent or disagreement with what's being said. Never once do the Board of Governors or those chancellors back down or denigrate people for opposing what's being brought forward. They hear it fully and they give it full consideration. So I strongly encourage that we put forth, put this aside and not decrease the number of speaking, because you may not always want to hear what's being said. We don't always want to hear what's being said, but sometimes we need to hear it. So I would appreciate you giving consideration to our concerns. Thank you.
Thank you. Item 16, reports and announcements, Academic Senate, Leonardo.
Good evening. I appreciate the opportunity to address the board this evening. The Senate continues to work behind the scenes, faculty providing and attending professional development events. Curriculum is being reviewed and approved. Most recently, 34 courses and 18 programs were approved at the last APP meeting. And 500 more courses and programs are in the works for the approval process for the 22-23 academic year. Program reviews are being worked on as we speak to meet the fall deadline on the November 15th deadline, and accreditation work is well underway. I express appreciation for all those who co-chair or are members of the standing committees. In relation to agenda item 14.1, the Academic Senate shares in the board's appreciation and celebration of Diane Knippel's service rendered and continues to offer in which she continues to offer the district and campus community. Her support of the Senate and its scholarship funds is another example for dedication to AVC and its faculty. In relation to 14.2, for my gratitude to all parties who work to make this possible. In relation to 14.7, we support this action item that will provide temporary housing for some of our most vulnerable students. This will strengthen the already existing programs and partnerships that might help our AVC students. In relation to action items 1415, 1416, 1417, we applaud the board's approval of these items and encourage continual support of programs, activities, and services that will strengthen the district and campus commitment to diversity, and building cultural understanding and support for student success. In relation to campus safety and the quarantine process, I want to express public acknowledgement for the ongoing work in relation to COVID-19 safety measures as the district has increased access to both testing and vaccination on campus and other improvements as shown tonight in item 11.1. This work is critical and is important in creating the safest learning and work environment possible. However, there have been many concerns forwarded to my office regarding the timeliness of contact tracing, notifications of either instructor or student exposure or positive diagnosis of COVID-19 and to the process of quarantining. In some cases, the information seemed contradictory. Most recently, I've been invited to be part of the COVID tracing subgroup, and I appreciate that invitation. I appreciate the board's approval of items 14.4 and 14.5, and further invite the Board of Trustees and the district to continually evaluate and make improvements to the existing processes. In relation to the Senate resolution, Fall 21 COVID-19 resolution. On September 16, 2021, the Academic Senate passed the resolution mandate for vaccinations or testing for all VC students and employees. At the request of the Senate and by permission of the board, I'd like to read that resolution. Whereas the Antelope Valley Community College District state of emergency was declared by the board on March 16, 2020, to allow district-wide response to the growing COVID-19 pandemic threat. And whereas the Antelope Valley Community College District, who is committed to providing a safe and healthy working and learning environment, which continues to follow COVID-19 guidance and regulations as applicable, issued by the United States Centers for Disease Control and Prevention, California Department of Public Health, California Department of Industrial Relations, Division of Occupational Safety and Health, Los Angeles County Department of Public Health, as well as other health orders from state and local public health officers. And whereas the communities in and around the Antelope Valley show vaccination rates under 50%, which are some of the lowest vaccination rates in Los Angeles County. Whereas the Antelope Valley Community College District student body includes many of the underserved populations which have been affected unequally by the economic, health, and social consequences of the pandemic, racially marginalized communities who comprise the local fatalities during the pandemic. And whereas the COVID-19 vaccination is a safe and effective way to prevent people who are vaccinated from becoming seriously ill with COVID-19, according to the Center for Disease Control at Johns Hopkins University. And the Pfizer vaccine has received full approval from the U.S. Food and Drug Administration, while Moderna and Johnson & Johnson COVID-19 vaccines have received emergency use authorization.
Excuse me, Mr. Ryder.
Yes.
With the board's permission, I'd like to allow Mr. Ryder to go beyond his 5 minutes to finish the statement.
I'm sorry.
You may go on.
Oh,
Go
I'm
ahead,
sorry.
continue. Go ahead.
I appreciate that. Thank you. Whereas the California Community College Chancellor's Office and Board of Governors have urged students, faculty, and staff to take action to protect Californians from this fast spreading and deadly SARS-CoV-2 virus by getting vaccinated and have informed that this is the local district's responsibility. And whereas the California State University, University of California, and other community college districts of Los Angeles have imposed a vaccination and/or COVID testing requirement upon students, faculty, and staff for Fall 21 term. Therefore, be resolved that the Antelope Valley College Academic Senate recommends the district to implement the following provisions, and I'll summarize for time's sake. 1, regardless of vaccination status or future Los Angeles County public health protocols, that all employees, students, and volunteers shall wear face coverings in indoor on-campus settings. 2, 3, and 4 are related in the sense that all district employees, all students, and all volunteers would be then required to either present proof of to human resources that they've been fully vaccinated or undergo weekly testing. Copies of this resolution have been sent to the board for review. The Academic Senate recognizes the Board of Trustees' role and responsibility in the decision-making process for the district. It is no small task as it comes with much accountability and expectation. We also recognize the enormity of the logistics and planning required to meet many federal, state, and county guidelines in regards to the pandemic. In respect to the aforementioned resolution, we invite the board to review the resolution and consider most carefully its recommendation and merits. Like each of you, we are concerned with the ongoing effects of COVID-19 and the safety of the entire campus community. Thank you, ladies and gentlemen.
Thank you. Item 16.2, Antelope Valley College Federation teachers, Dr. Bird.
All right, well, good evening again. And I want to start by thanking Van for reading the Academic Senate's resolution. The Federation is supportive of requiring vaccination or testing, regular testing for anyone on campus. Congratulations to Diane Knippel for her work with the foundation. She's doing great work and we're really, really delighted for her recognition. As far as student things, I know that right now this is the Undocumented Student Week of Action, and I'm very supportive of that, and I'm glad it's happening on this campus, and I hope that those students feel supported. The vaccination clinics on campus and testing are fantastic. I did attend the vaccination clinic this week, and it seemed like it was really, really well attended. And I'm grateful to the college for hosting it. I think, lowering barriers to entry is important. So it's great that this is successful and looks like it's going to continue for a while. These are absolutely a step in the right direction. And in listening to what Trustee Reeves mentioned earlier, I know it's not really possible to offer the flu shot on campus on a regular basis. I know it's different funding and stuff, but I think it's a great idea to maybe be able to offer it at some point if they can work out the funding issues. Rick Shaw gave a great presentation earlier, and ITS has done so much to keep the college running through the pandemic. In particular, that student computer loan program is fantastic. I have so many students taking advantage of it. And one thing that I'll always remember is that in speaking with Rick, at one point, I said, but what if people miss the deadline or people's laptops break midterm? And he said, you know what, contact me anyway. You will always try to help them out. And as best I can tell, that seems to be completely true. And I might be getting in touch with you. I heard a sob story about a milkshake and a laptop just today. So not one of the schools ones, their personal one, but now they're computerless. So returning to more difficult COVID issues though, I've thought really hard about why the numbers seem, if not incorrect, but seem kind of funny to many people, and why it seems like the contact tracers are super duper overwhelmed, but maybe there's only 3 cases on campus, for instance. And I think I've come up with what the disconnect is here. In my opinion, there's a transparency issue. It seems like AVC is counting cases where somebody was positive on campus. The disconnect, though, is that those people that are positive on campus make a tsunami of possible exposures, and that ends up overwhelming the contact tracers. But beyond this, many of the folks who are quarantined due to the on-campus exposure don't end up getting sick, which is good, but some likely do, and those numbers aren't in AVC's case count. I'm aware of 2 cases of likely student to faculty transmission that I was told about by faculty who, as best we can tell, really have been staying in a pretty tight little bubble and were quarantined based on on-campus exposure and then got sick. And it's unclear how many more of that kind of case there are, because it seems like maybe the college is not tracking or reporting those numbers. And because these cases are technically happening off campus, it doesn't affect the official AVC case count. This has the effect of seeming sort of like there's a shadow epidemic occurring in the community. And this leaves people feeling angry or frustrated or confused or just flat out distrustful. I feel like an additional component here is, again, not requiring testing, because it's ending up being unclear how many people end up COVID positive after their exposure to positive cases on campus. And I know we're being told about declining case numbers, and there was a recent AVC COVID update that cites the New York Times for, declining case counts. But a week ago, there were 3 cases on campus, and then in the recent update, there were 8 cases. And something about that seems to suggest that AVC's cases are increasing, not decreasing. How many people were exposed on campus? How many people would not have been exposed if AVC required regular testing? We know that there are still multiple active outbreaks with 3 or more lab confirmed COVID cases in schools in our community. I checked the LA County COVID locations and demographics dashboard tonight. East Side, Palmdale, and Lancaster High Schools, and Manzanita, Mariposa, and Hughes and Lake Elizabeth Elementary Schools all have active outbreaks right now. How many?
You're at 5 minutes. Could you please wrap it up?
Yeah, I'm really close. How many of our students, staff, and faculty have connections to these schools? I recommend testing. Maybe it's not as bad as I imagined, but the only way to figure that out is by sharing data. I urge the college to commit to making public the number of people associated with the campus community who have been quarantined each week, and also the number who have tested positive, even if they've not been on campus. Transparency might go a long way to reassure faculty, staff, and students. Thank you.
Thank you. 16.3, Antelope Valley College Federation, Classified Employees, Panel Board.
Thank you. Congratulations, Diane, on your recognition. I wanted to also share one other thing with the board about COVID, and that is our lab techs, especially in the biological sciences. They're also not being notified of the exposures, and they actually set up and break down the labs. And so if students have been in those classrooms, they're being exposed as well. So it's really important that the proper people be notified of the exposures. And for my next point, I'd like to ask you as board members, why there's a delay in resolving the work hours per charge, especially in light of the fact that interest is accruing at 7% per annum from 2014. The delay harms both the college and its employees. And I have to ask, is it fiscally responsible to allow this interest to continue to grow? Because it's going to continue to grow until this is resolved. If
Mr.
you
Board
will-
President, the information that Ms. Ford is speaking about right now actually amounts to an unfair labor practice and appropriate for her to go around the process and speak directly to a board about an item that is pending before a PERB panel and compliance officer. So
Actually, I
it's up to the board.
spoke to my
It's up
legal
to the
counsel
board.
before I brought this forward,
It's up to the
and
board
that
whether you
wasn't the
continue to hear
advice that I
it,
was
whether you
given.
continue to hear
Well,
the
the board
matter.
will be listening to the advice of our legal counsel.
That's fine. Anyway, you will note that the appeal in the final appeal, PERB clearly stated that the reason for this for the cost of the back pay and the interest could have been minimized had this been resolved 33 months ago. So I'm just curious who's fiscally responsible and how long does the district plan to drag this out? And my last comment is, since this is the first reading and you had told Van that he, I think, had exceeded his 3 minutes. Did you say it's 5 minutes? So then the 3 minutes hasn't gone into effect
They
yet?
have not, it was an informational item, the board has not acted on it yet.
I just wanted to be clear because I was a bit confused. So thank you for your time.
16.4, confidential management supervisor, administrator employees, Michelle Hernandez.
Good evening. Great to be here this evening. Do want to congratulate Diane on her honor. We had our first general meeting of our CMSA group last week. We did go through the survey results that we put out at the beginning of the semester, just to hit some highlights and hot topics, just kind of keep you abreast of what we're starting to work on. Cross-campus collaboration had 55, almost 56% of hot topics votes. So we will be working on how do we do better and do more with our cross-campus collaboration as managers on campus. The other thing was policies and procedures. So getting greater input from the CMS group as we bring those policies and procedures through CCC and have an input in that regard. Professional development is also high on our priority list for this semester and for this year, as well as career mentors. That is a new thing that we've talked about in the management group. And so 63% are interested in receiving some type of career mentor, whether that's here on campus and peer-to-peer, or if that's looking at opportunities such as ACA to have peer mentorship for careers. Other than that, we are looking at how we can continue to build trust across campus and to lower those walls and silos so that we're all working together and collaboratively for student success.
Not seeing ASO representative. So
He sent me his report so I can
Okay,
serve as a
go ahead.
proxy. Thank you. So during the last ASO meeting, they talked about COVID with Rhonda Burgess, who came to talk to them about what the school was doing to combat COVID. They learned that the involvement in the basic needs market is low and were to ask to find possible ways to increase participation among students. We are also working on a volunteer service, but ASO is still discussing it and what it will look like. So there isn't much to say for now until we have a more concrete plan in place.
thank you. Antelope Valley College Foundation, Diane.
I'm honored and humbled by my community service recognition and support of the college and Antelope Valley Transit Authority and the recognition from my peers as well. So thank you. It's very humbling. Good news. So Michael, you were talking about Barnes and Noble. They are going to be a very good partner in the future. They have set up an endowment with the foundation, and they also have taken 7% of the non-book sales, but the retail sales, and using that to contribute to their scholarship as well. And speaking of June and July, July was pretty low. August was a lot higher. Students came on campus, they were spending money. So it's going to be a good partnership. And just remember, the next time we meet, we'll be in the campaign for Giving Tuesday. Those you remember, Tuesday after Thanksgiving is the Giving Tuesday National Day. And we've been doing this for the last 3 years. Just some good statistics. We're looking at payroll deductions, community sponsorships and support. The first year we had 3,000 raised. The second year we had 7,000 raised. And then non-COVID we skipped, of course, but the third year we had a little over 15,000 raised. And some of that was based on kind of you put it in and we'll find a sponsor to match it. So it's all going to the Hearts and Hands Pantry, and that endowment is getting very large. So it's a great support for all of our students. So thank you.
Office of Superintendent President.
Thank you. Just a couple of quick things. Dr. Zimmerman, who is in charge of commencement, has been working with her team. And this coming year, regular commencement will be on Friday, May 6th. However, because we missed commencement in the spring of 20 and in the spring of 21, we are going to be inviting those graduates back on campus on the 4th, May 4th, so that they can get their picture taken and be presented a jacket and those kinds of things with myself and whoever from the board can be there. So that's one good thing that we've been working on doing. Sage Hall is going to be dedicated on Friday, October 29th at 10 a.m. You're all welcome to come out and watch the ceremony as we cut the ribbon and open that beautiful facility. As a matter of clarification, and I'm sorry Professor Despain didn't stay, flex means face-to-face with the flex option. So it's there and available, and that the technology that Rick and his team have so admirably put in all the classrooms is available to flip a class if you have to, or allow students if they're ill to not come to class, all kinds of options. That's what that means. And that's why that option is attached to that scheduling, but they're face-to-face with a flex option if necessary. I do my checking as well, and the 7-day average for Los Angeles County through the 10th of October was 0.87%. This is down from 6.8% in August. The vaccine rate, combined vaccine rate for Lancaster and Palmdale is 65.9%. We are doing these things on campus as best we can to provide the resources. And I want to emphasize again, no one in the United States or across the world has done this before. We have never shut down a country. We have never shut down and then required to trace a self-reported incident. We don't know if somebody tested positive unless they tell us. And then we have to back up sometimes 5-7 days to figure out where they were. It is not an automatic process. We can't require them to do it. And it's incumbent upon, because it's self-reported, it's incumbent upon the individual to inform their instructor or their supervisor. Thank you.
Board member comments? Mr. Bell?
Thank you. First of all, I'd like to congratulate Ms. Kniffel for recognition. Secondly, I'd like to encourage everyone to attend events for the Undocumented Week of Action, as well as attending the market on Thursday. I would also like to wish good luck to all students who participated in the Constitutional Essay Day contest.
Thank you. Ms. Ivan?
Yes, I would also like to congratulate Diane Kniffel on this prestigious honor. And I'm glad to be a part of the vote. For the Associated Student Union organization, I am glad to hear about a volunteer program being discussed. Service learning is extremely important. Thank you.
Thank you. Mr. Reed?
Yes, first of all, I want to thank the IT department. The audio was fantastic. We could hear you loud and clear. We appreciate it. Vic, we want to thank you for everything. Yeah, I'm blown away. I never envisioned what you had to do. I thought maybe you just turn on the laptop and you saw you. No, it was great. Rhonda, thanks very much for the COVID tracing. And as far as the 5-minute rule, well, most people know that I've attended more board meetings than anybody up here in the AV. I still attend board meetings. And as far as I'm concerned, you're the boss. And I'm here to listen. And I'll stay here till midnight to listen to you. I don't know about my fellow board members, but I will. I'm here to listen and hear what you have to say. Thank you.
Okay.
Yes, I would like to say to Rick, outstanding presentation, Rick. And I'm probably one of those people that would be like bugging you all the time because I do that with my own IT guy. But a tremendous amount of work for you and your team. Just really, really appreciate it. And to Rhonda, I want to say I do a little contact tracing sometimes. I'm on our COVID team, and I know how difficult that work is. And I know that there's HIPAA laws, and there's so many things that there's modified quarantine, and there's so many things that you have to take into consideration. And so I just want to say you're doing an amazing job. Keep up the good work, and I don't envy you. It's not an easy job, and I understand that thoroughly. And I want to say to Diane, congratulations on being recognized by the community. I can't think of a better honor for any human being, and that speaks volumes about who you are and the great work you've done since you took over our foundation as the leader. So congratulations and thank you.
Okay, couple quick things. First of all, Dr. Bird, your question with regards to number of speakers that you've seen in the past, from a historical perspective, we've exceeded those numbers by far, the ones you were quoting. So yes, we have had a lot of speakers at times, and the meetings and those particular sessions have gone on a long time because the board has the discretion to allow that, just as Mike gave the discretion tonight to extend those. So that's the way it functions, and it's been functioning like that. Couple of things. I want to say I do listen to what you guys say out here, and there was an instructor here that talked about students wearing masks on campus or not wearing masks. And something I decided, since I'm out here all the time, I decided to take a couple of days and walk around and really pay attention to students with masks on, or staff in areas like the subway area, the corridors of classrooms. And the interesting thing, and I think maybe as it's kind of a societal issue, I suppose. We want to focus on the outlier. And what's amazing is if you look at it from a whole, all these students are wearing masks inside those corridors. They're wearing masks in subway. They're wearing masks walking across the campus. Now, you may see one or two sitting alone, or they may a couple of them an outdoor table doing it. And I'm not saying that that doesn't happen from time to time in a building, but I spent 2 days at a time when a lot of students were out here and moving about on campus, and it was amazing how many of them were following it. So I think maybe we need to focus on the overall numbers and not the outliers, because there's always going to be an outlier. Funny, I went to Target after I left the campus, and yes, I did see a lady with a mask wrapped around her neck. So you're going to find them occasionally, but for the most part, I think we're doing a really good job. There's a question, and I take these things, I've been asked this a couple of times. People are asking, if we went to a mandatory vaccine program, what would be the exemptions to this? And people say we have to have exemptions. And COVID antibodies came up, or you've had COVID, you have the antibodies. That's a question that needs to be answered by a public health official, because that's a legitimate exemption. I think if you go down to test, you've got the antibodies, and I know people who do, then you got to get into that. Otherwise, I would say this, everybody I think is chipping in. I would ask you again, pull together, work toward the common goal. Thank you, that's all.
Thank you. There is no reason to go back into closed session, so we will be adjourning our meeting until November 8th, 2021. I would like to adjourn this meeting in honor of Dr. Kathy Barber, former Dean of Language Arts and former interim VP of Academic Affairs. She retired quite some time ago, but she left us back in 2005, 2006. My wife worked with her very closely for 5 years. She lived the dream. She retired to the south of France to a small farmhouse and lived her life there, and recently passed away in Paris. And so I would like to adjourn this meeting in her honor, because she was very important to this campus. Thank you.